Welcome to the McAfee Taft webinar series. The topic for this webinar, effectively managing medical plan costs. As healthcare costs continue to rise, employer sponsors of group health plans are under increasing pressure to manage costs while also ensuring compliance with a complicated web of regulations. In recent months, there have been a number of new developments at both the state and federal level, some offering positive change, others merely adding further compliance requirements that will impact an organization's ability to control such costs. In this presentation, we will review recent legal and market-driven developments in the industry and discuss new and innovative ways to manage medical and prescription costs.
Hello, everyone, and thank you for joining us for our webinar today on effectively managing medical plan costs. I'm very grateful to my friend Chris from Healthcare Highways for presenting with me on this topic, and I think we've got some good information to share with you today. There's actually been a lot of development in chatter in the healthcare space from a legal and regulatory standpoint, but also on the more practical side of kind of managing claims and trends and spends. And so I think you'll find some good information from on the legal and regulatory front, but I think Chris also has some good practical updates in terms of what employers are doing and new initiatives now to manage and healthcare costs. Before we jump into our topics, I think it's interesting to point out for those of you that manage retirement plans and health plans, a lot of us in this space kind of split our time between 401k plans and health plans. I want you to think about for a second how much you know about the vendors that provide services to your retirement plan. So if I was to, and I'm just talking out loud, if I was to think about the McAfee Taft 401k plan, we have an investment consultant, we have Fidelity as our record keeper, and we have an auditor. And for each of those three pieces to our retirement plan, I know exactly how they get paid. I know how much they're getting paid and whether what they're getting paid is reasonable. And why do I know that? Largely because the government has mandated, starting back really in about 2011 or so, they've required service providers to disclose all the ways that they get paid, and then they put this burden on fiduciaries to understand whether the fees that they're getting charged are reasonable. In the health plan world, there's none of that. There is not the regulatory requirements that we have on the retirement side to understand how everybody gets paid directly and indirectly, and whether what they're getting paid is reasonable or not reasonable. And this is at the employer level. There's not the rules at the employer level, and really there's not great rules at the patient level. And so I think of what you'll find today, I think we tend to focus when we give these webinars on or we're speaking about healthcare spend, we're talking a lot about disclosures or lack thereof at the employer level. But I think a lot of what is out there and what you'll see on this today's topic slide really relates to disclosure requirements, more transparency, more information to patients, more options for patients. And so I think it's interesting to me that we are really at the patient and provider level or the government is wanting to give patients more information to make better decisions, but we also still need more information at the employer level to help employers make better decisions as well. And so I hope we touch on both of these today as we kind of cruise along. So today's topics, we're going to talk about President Trump issued a new executive order on improving price and quality, transparency. We're going to talk about this proposed legislation. I think we will see sometime soon final legislation requiring, or preventing surprise medical billing, which is a problem that a lot of employers and employees deal with. Talk about some new pretty cool options for employers to establish HRAs, two new types of HRAs that are available in 2020 that have not been available before. We're going to kind of keep it local, at least as it relates to that fourth bullet point, and talk about a new Oklahoma PBM law, pharmacy benefit manager law, regulating pharmacy benefit managers in the state of Oklahoma, and talk a little bit about that. And then we're going to talk, or Chris is going to talk a lot about new practical cost containment strategies that employers are taking advantage of and that are hitting the marketplace and will be hitting the marketplace as we roll along.